Mr. Atkinson would be willing to come up and we're going to have a discussion. The way this is going to work is I'm going to actually briefly talk about what each of them have been through in terms of their therapy and sort of an overview of their experience. I'm going to ask them a couple of questions to allow them to expand on what they've thought about participating in clinical research. And then we're going to open it up for questions that might come from the audience for these gentlemen who again, very generously have participated in research. So I'm first going to talk about Mr. Atkinson. In his 40s, he was diagnosed with widely metastatic prostate cancer. He was started on standard hormonal therapy, received docetaxel, which is now a standard intervention if people are diagnosed with widely metastatic disease. Participated in a randomized study of local therapy, in his case a prostatectomy, in men with metastatic disease. Subsequently has participated in several studies here, a Provengen IL-7 study, randomized study. He's participated in the liquid tumor biopsy study, which Dr. Schweizer talked about earlier, and he is participating in what's called the PCF Stand-Up to Cancer sequencing effort, which continues to go on at our institution, looking at molecular changes in prostate cancer and metastasis, which requires doing a biopsy. I think you may have heard about that earlier in the day. So Mr. Thompson, similar story, had some local therapy, ultimately developed metastatic disease, was on hormone therapy, and then on a clinical study we had with abiraterone, with or without something called a PARP inhibitor. You may have heard about that earlier in the day, or you may hear about it in a few minutes. Ultimately, participated in the stand-up to cancer sequencing approach at the same time that he participated in that study. Subsequently went on to multiple other therapies that in fact were not working as well as we would like, and then as a result of the stand-up to cancer sequencing data, which at the time that it was first found didn't really have any impact on his care, but in the meantime new data had come out that suggested that different interventions that we hadn't thought about might be useful. He was started on that therapy and did have benefit. So did that summarize things okay for you guys? Okay. So again, I just want to emphasize how generous both of them have been in terms of being willing to go through this. So I'm going to ask each of you to take turns answering these questions. So for each of you, I'll start with Mr. Atkinson because I started with you in the first place. If you could just give us some ideas about what you think the main reasons that either you participated in research or the main reasons you think anybody should participate in clinical research.
Sure, yeah, this is working good. So for me, maybe I think what I'll do is kind of start with a little bit of my story. And so as you mentioned, I was 45 when I was diagnosed, and cancer was not on my radar at that time. It was totally unexpected. I didn't have a family history and did not have a lot of deep experience with it. So I started having back pain and wasn't sure what that was all about. Eventually got into a radiologist who gave me an MRI, and she was a dear friend, and she said, "Scott, you have widespread metastatic disease." And I'm like, "Well, what is that?" And she said, "It's cancer, you need to get to an oncologist." So I felt like really I had just landed on a different planet. I had no idea what to do. And I started my cancer odyssey. And like probably many of you in here, the first thing I did was go on Google. And started going, what is this disease I have and how do I conquer it? And I stumbled across a video on YouTube that was a guy named Dr. Trip Cassell. He was a doctor at the University of Texas, and he talked about his story. And it was, there were some parallels. He was a younger guy when he was diagnosed, and he stopped his practice, and he was being treated at MD Anderson, and then he volunteered for the war in Iraq. And it was really an inspiring story, and it just completely touched me. And at the end of the story, he talked about some of the clinical trials that he participated in, and he had this big encouraging message of, if anyone asks you to get into a clinical trial, just do it. It's how we advance our science, and so that kind of resonated with me. And so I had my workup done at the Mayo Clinic in Scottsdale, and then I went to MD Anderson because I wanted to go see what this organization was about for a kind of a confirmation of the treatment plan. And when I was there, my doctor there was Paul Korn, and I said, do you have any trials? Because I'd really like to start getting involved. And up to that point, I kind of thought clinical trials were something that you did at the end of, kind of cancer treatment. And I didn't have a lot of hope that there was something to start with. And he said, yeah, in fact, we have this great trial that is working on local therapy for people who have advanced disease, which is not something we normally do. And so I said, great, sign me up. And I was interested in just being part of it. And I thought from Trip Cassell, who said it's the way science advances, really resonated with me, and just like that. So I was in that study, and things were going along, and then my cancer started progressing a little more. My oncologist, I live in Spokane, my oncologist over there, it's not a research organization in Spokane, but I started the next line of therapy. I had Provenge, and I asked Dr. Korn at MD Anderson if there was anything that they were doing with Provenge, and if that's what I said, he said, no, I think you should do Provenge. We don't have any trials going on. I asked my oncologist in Spokane, and so he looked. He said there's 2 trials in Cleveland, and then there's one in Seattle. And so I went on clinicaltrials.gov and looked up a Provenge trial. I can't remember what I searched, and the one in Seattle came up, and somehow on there, and probably you may not like this, but Dr. Yu's email is on there as the lead clinician. So I was just walking down the street, and I got my phone out, and I emailed him my story and said, I'd like to participate in your trial. And I'm not kidding you, like 38 seconds later, I get an email back. It was amazing. And it was Dr. Yu, and he said, here's what you do, and here's where we are, and here's how you get in touch with them. There you are. And I'd never experienced that before in my whole life when it came to the field of medicine. Doctors had always been hard for me to get a hold of. And so that changed my life, just this organization, and I got even more excited and met with Dr. Yu, and he signed me up for another trial at that time, and it's been a wonderful journey for me, and I would encourage anybody, if you have the opportunity to talk to your oncologist or where you are at your stage, if there's something you can do, because I don't know if it's helpful for me, but it's fun, and I like the fun aspect.
Thank you.
Well, I'm Sandy Thompson, and I don't think I can add very much, actually. My colleague here pretty much covered the ground. I, like him, and like probably anybody else in this situation, the first thing I did was start burning up my search engine, and discovered in the process of, kind of random knocking around the internet that clinical trials aren't exactly what I had thought they were, and that you can do clinical trials early in your treatment, and that they're not all sort of double-blind studies where you don't know whether you're getting a sugar pill and somebody's standing somewhere with a stopwatch to see how soon you kick the bucket, right? They're not all like that. And so when my initial hormone therapy sort of stopped working, and I got a chance to get into the study with abiraterone, with or without ABT 888 or something like that. I was randomized onto one branch of that, but I knew what I was getting. My doctor knew what I was getting, and it actually worked for me for quite a while, 26, 27 months, something like that, which I think is longer than the statistics I saw. You see these statistics in studies that, well, they get an average of 5.2 months extra lifespan, and you think, what for? But when it's you, and you're in that fight, it feels like significant. And the other thing is, I have been, my cancer was graded at Gleason 9, borderline 10, so it's very dangerous, moves fast when it moves. And I wouldn't be here now without some of the more advanced treatments that are available. I was taking stuff that wasn't on the market, a year before, a year and a half before. And so I benefited from all these other dudes donating their data. So when I get a chance to donate mine in return, well, maybe I can help somebody else. Maybe I can help you. Someday, this disease is going to be, it will be cured or it will be managed. And it will become something that people die with instead of because of. And I don't want to be the last guy to kick the bucket before that happens. but if I do, my data will still be around. And it'll be helping people. And so I was tickled to be in this study. And I'm off the study now because, it stopped working. I'm on something else, which is not a new drug, but a new application of an existing drug based on the Stand Up to Cancer biopsy results that they got, or genome results. And I have no regrets. I'd be on another study in a heartbeat.
How are we doing, Tom?
I think a few questions. If
Okay.
anybody from the audience or questions about.
Let's say 2 questions. Anybody have questions for these gentlemen? Yes.
Did you find out afterwards if you're on a placebo? Or did you never find out?
For myself, I wasn't on a placebo study, so I can't tell you.
Yeah, I was in one randomized study, and I found out at the time of randomization that I was going to be on the either control arm or not control arm, but it basically I was not getting the drug. So I was, I didn't take a placebo though. It was just not getting the drug. But in my case, it was giving blood every few weeks. So.
Okay, thank you.
Right. There are many phase 3 studies that are not placebo-controlled. So you do actually know what you are getting. And I think that's something that a lot of people are leery of, which I absolutely understand. But there are, as I said, there are many studies that are phase 3 that you do know all the components so that both you and your doctor can adjust based on that.
I will add one thing though, because I had some thoughts that tormented me for a while. My first study was randomized for either having surgery or not having surgery. I got randomized to having the surgery, and I was thinking, well, what if they gave the surgery to everybody? But some people, they just didn't take your prostate out. I don't think it's kind of a weird placebo.
We live in the land of nightmares.
Any other questions? All right. Can we have another round of applause for these gentlemen?